Yay! So how are things going with Phynix Rising? Yay!
I'm excited. I am dope excited. We just got the room.
Yes! Very happy.
We just got the other room. So now we have 3 therapists, including the nurse. And so we have 4 rooms total. And that doesn't include the office. So we have the one room where we do the wet draining, and then we also have body contouring on both sides, and then we're actually going to be utilizing the other room for massage. So that's going to put all of our services together, and so we have a whole team.
Yeah.
And then I'm excited. I'm very, very excited. And then of course we have other things that are lined up for 2021. Where we get to work a little bit closer with you. We get to work a little bit closer with our registered nurses. And then, of course, we're doing transportation system. I told you about the ebook, told you about the manual stuff. So,
yay.
And of course, IV therapy.
Yes.
Yo!
Are you excited? I'm excited.
What have you found out?
So, I have found out a lot of stuff. So, there's a lot to be done with IV therapy, including, especially for your patient population, pre and post-op. So there are some folks that are coming to me that they're getting their procedures done. Okay. And so one of the things that we're trying to make sure that the patients do is they're optimized before surgery. Okay. So one of the big things that I've seen, especially with the ladies, is anemia. And so, and most of what I found is that most of my patients don't consider it a medical condition.
No, they don't.
So it's like, do you have any medical problems? No. And then I'll go down the list. Oh yeah, I'm anemic. I'm like,
Or after surgery, they want nothing but ice.
Yes.
Yeah. Ice chips.
Like, let me check your blood count.
Right, yeah. You need some ice chips. Yes. Anemia is a huge thing, especially after surgery. Especially after surgery, it really does show up, because they take that into healing, and
once you get cut, you're gonna bleed, so that number goes down. Okay. So starting with a good number is crucial. So
and they know that.
Yes,
they know they.
So that is one of the things that I've taken, upon myself when I have patients that are primary care patients that are considering surgery. I want them optimized. I want their counts looking good, especially if they're women that are menstruating. I need them optimized there. Blood sugar, blood pressure. I need them totally optimized for surgery. Surgery's heavy on the system. So
you're doing pretty good.
So that, yes.
Okay.
Especially with IV therapy, I want to make sure that I have them boosted. Now, if their numbers are like, pretty close to great, then, we might just change their diet. If they need like a little oral therapy with iron, then we might do that. Okay. But a lot of what I've been seeing is that people have pretty like heavy cycles, and they've been bleeding lots for a long time, and they're just used to it. And they don't consider that it's going to get worse when they have their surgery. So...
Well, it's been known that surgery will actually make the cycle come on a whole lot faster. So,
not only are you anemic, but now you're going to bleed some more.
All over.
Yes.
And and so I always ask whenever they come in, especially smooth, within that first week of surgery, when was your cycle? Because it's really going to determine how you actually recover from your entire surgery, how you take the massage. Are you going to be nauseous? Is it going to be? I want to know also what's going to be happening, because it's very few times where I get to see them before surgery. I get to talk to them over the phone. I get to ask certain things. But then when they come in, it's like, hey, are you on a cycle? Or it'll kick off during the middle of surgery.
Right.
Like I wasn't having it, or it'll be off. So it takes almost 60 days after surgery before it's kind of normal. Some people just don't have any issues completely. But it is, you're a little more debilitated, you're feeling that a little bit, stronger. If you're on your cycle or during the entire surgery. There's some of my doctors that they don't like to do it, while you're on your cycle. Right. They'd rather just wait.
Yes. And I understand because you're going to lose some blood during the surgery. That's a given. Then you're going to bleed. Then it's, could be a little bit off because this is a stressful event that's happening to your body, and that can affect your cycle. So yeah, I totally get the
bacteria.
I want to wait. Oh yeah,
you get bacteria. You already have to stay clean. You already got stuff going on internally. Now you about to have stuff going on externally. How your garment does. So it's a very messy process.
Yes. So, for my patients, I'm like, I want you to know this is what we need to do ahead of time. And then post-op, making sure that, like you mentioned, nausea, that can affect whether you get enough nutrients in. If you're nauseated and you're not eating, your body needs certain things to recover after surgery.
Your stomach is completely empty. It's very, very common to throw up. Definitely to be constipated after surgery. You are expected to be constipated.
Fun.
When did you poop? Have you pooped? Yeah, have you had a bowel movement? 3 to 5 days is usually okay, but sometimes longer. So right after surgery, you are expected to take something that kind of helps stuff move along.
Yes.
But folks, there's a lot of people that already have digestive issues before going into surgery, so they just really do become more exemplified afterwards. So I do believe that the IV therapy can help with that, especially dehydration.
Oh yes.
Folks already don't drink enough water or have enough fluid inside of their bodies. A lot of
some nausea to that. They're not gonna.
Oh, I've had it.
Or pain. Like, I don't need to go use the bathroom, all these many times a day. It hurts. Like, no, you do need to use the bathroom.
That's how often. Yeah, you should. Please. 5-6 times. So please, as much as possible, get that stuff out of your system. And I think sometimes you are using the restroom more than you can actually take it down, right? So I think, the IV therapy helps with that. That nausea is everything. Those headaches that you were talking about.
Oh, yes.
Those are everything. And just, feeling better. Folks usually do have to go back to work within 2 weeks, of surgery. So,
yes.
Yes. I have one right now. She just had surgery and a week out. She's having to go right back to work, and this is pretty heavy stuff when you're thinking about fat transfers. You want as much downtime as possible, but you also want to feel better, in that meantime.
Yeah, and so I think that can definitely help. Kind of get them back to normal faster.
You have one. There's the mineral, right? Minerals and vitamins.
Oh yeah, that's like the primary. What we put into the bags, and then we really look for deficiencies and something that's not quite a deficiency, but not optimized. And so there's a lot of times where we'll have like the bare minimum necessary to live, but not enough to really function. That's right. Optimize. So that's one of those things where it's like, okay, we're gonna look at your level. Okay, it's not terrible, but it's not great. Okay, and so we try to go from I to great
because you're looking at it, right? You're kind of having to look at how they're moving along, pretty much, and how fast or what the rate is of that.
And a lot of IV therapy solutions, they don't look at the before and after.
That's
like, did we accomplish what we set out to accomplish?
That's right.
If your levels were low, did we get them up? Did we get them up enough? Or is it just, barely more than it was before? Okay. And some of this stuff you have to do for maintenance, Some people hold on to minerals. Some things are water soluble, and we just don't hold on to them long, and so you may have to dose repeatedly. Okay. You may have to also introduce things into your food plan. Okay. You may have to take adjunctive vitamins and minerals that help them get absorbed better. Okay. And so I think sometimes, with just some of the standard things that are done, we don't always consider all of those things.
Not at all.
And that's why I really like to say, okay, this is your plan. Correct. This is what you look like right now. Correct. And then check it later. This is now where we are. How can we either get to where we're going, or are we here? How do we maintain? So those are all
I like her perspective, because it does go along with our module of being holistic, and that's looking at the entire function of the body, not just, okay, you had surgery, you look cute, you look pretty, your body's banging. What's going on the inside?
Yes. And I love your...
what's going on the inside? We need to know what's going on the inside, because you can have stuff that is off. You can be beautiful and be having a ton of headaches. Or retaining, or you can, you can have a banging body and you could be inflamed. Yes. And have, certain spots and stuff, here and there where you actually do need additional care. So I like the fact that you just don't zoom in on one thing. It's the entire picture, let's get deeper into what's happening so that way you can actually get real, help.
Yes. And I love your philosophy of, I'm not a one-night stand. I'm a long-term relationship. Because you need to know like exactly what's happening now,
right?
And we need to go through this.
Yes,
you know, not just here's some stuff. Good luck.
Yeah,
you know?
good luck. No, yeah, you already had someone that did that. We're not gonna do that. Yeah, we're not gonna do that. This is actually really, it's a journey. It's a marathon. It is not
a sprint.
Amen. It is not a sprint. Your body is not to be toyed with, and we, I think we both, take that part very, very seriously. Where I can focus on what I can within my scope, and then you can take it to a whole other level to where it benefits the actual client, the actual patient.
I think we make a good team.
Boom.
All right.